Warren.
Here.
Aaron Johnson.
Here.
Bucher.
Here.
Ben Johnson.
Here.
Smith.
Rise for a moment of silence, followed by the Pledge of Allegiance. Thank you.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The gavel means something else in my world.
Yes.
I stand up every time you hit it.
Please rise. Item agenda 1, consent agenda. Approve this agenda, pay the claims as submitted, approve the treasurer's report for April 2026. Courtney and Nick.
Tillery.
Yes.
Hart.
Yes.
Warren.
Abstain.
Aaron Johnson.
Yes.
Bucher.
Yes.
Ben Johnson.
Yes.
Smith.
Yes.
Weeds.
Yes.
Thank you.
Item agenda 2, approve the minutes of the May 5th, 2026 regular meeting of the City Council.
Have had a moment to make a correction.
Yes.
Earlier with Dane to what was mentioned as our comments, my comments about the ballpark.
Okay.
I made some corrections there.
Okay.
Dane says you're just gonna have to trust him, it'll get it written in later.
Okay. All right. So, approval with amendments.
Right.
Okay.
I'll make that motion.
Okay. And Trent moves. And Ben seconds.
Ben Johnson.
Yes.
Smith.
Yes.
Weeds.
Yes.
Tillery.
Yes.
Hart.
Yes.
Warren.
Abstain.
Aaron Johnson.
Abstain.
Bucher.
Yes.
Thank you.
Item agenda 3, public forum for non-agenda items. See nobody for public forum, so I'll close it at this time. Item agenda 4, consider health insurance options from the Jones Group.
Thank you, all members of council, for allowing us to be here tonight to introduce myself. My name is Dan Schwarzkopf. I'm with the Jones Insurance Group, 2835 West Highway 6, Hastings, Nebraska. I work within a variety of our offices. The Jones Group has 16 offices across the state. I've personally been involved with the employee benefits program for cities, municipalities, and commercial businesses for the last 33 years. I've made calls on the city of Holdrege many times over the years, kind of going, my notes here kind of went back to 2009. So I had an opportunity to meet Dane many times over the years, met Chris when he started, and earlier in the year I just reached out and kind of asked how things were going regarding your employee benefits program. And as many of you probably know, the benefits area has gotten very expensive. Healthcare in general continues to rise significantly. I don't come across an employer any place that's not concerned about the ongoing costs of providing those levels of benefits. The city of Holdrege had been self-insured at one point in time, as some of you may recall, and had moved to a association type plan called the LIGHT program, underwritten by Blue Cross and Blue Shield. I also was a direct employee of Blue Cross and Blue Shield for 11 years as a senior account executive, and had resigned back in 2005 to buy an agency and helped manage that agency for 15 years before we merged it in with the Jones Insurance and Financial Services. They are a family-owned, Nebraska-based business, which is why we felt comfortable merging our locations in with the Jones Insurance Group. So having reached out to Chris and Dane, they said, yeah, let's take a look at what you might have out there in the industry. The current association plan that the city's a part of has had some double-digit rate increases and faced with another one for July 1. So I'm going to hand out kind of a summary of what we've, our research and homework, if I can. And pass those down. This is specifically pertaining to the health insurance. There's 3 copies there. So, this is specifically pertaining to the health insurance program, and I can talk to you a little bit about the other lines of coverage. Okay, great, thank you. Anybody else need a copy? You got yours, okay, thank you. So again, we went to the marketplace, we looked at several different carriers. We have a large stable of carriers, but some of our carriers won't quote on municipalities or what they call non-ERISA groups. And so what you have in front of you is the results that we've come across from 4 different carriers actually to this point. And the first 2 columns on the left are basically just describing to you your current costs and the plan designed for the employees. And then the second column to the right is the renewal from that exact same plan. So just to kind of quickly walk through it, because I don't want to assume anybody recalls the benefit levels for this plan. But this first plan, highlighted in yellow in the upper left-hand corner, is your copay plan. So the city offers 2 different plans to the employees. This program is a $1,000 deductible with an 80/20 co-insurance and a maximum out-of-pocket, where it says OOP there on the left. That just stands for out-of-pocket maximum. So the employees have a $4,000 out-of-pocket maximum, and then you can see the applicable co-pays there for your office visits or a specialist, to see a specialist or urgent care. And then you can see the co-pays for your prescription drug program. And then directly below that is the current number of enrollees in that particular plan. 11 that are employee only, 1 that's employee spouse, 3 that are employee children, 9 that are full family, for a total of 24 people in that particular plan. Again, the next column to the right is the renewal, and you can see that's coming in at just a little over 15% again this year. So the next couple of columns, we trying to compare as closely as we possibly could to your existing plan, not asking the employee to pay anything different out of their pocket in terms of deductibles or co-insurance. So that third column, UHC, that's United Healthcare, one of the largest carriers in the nation. You're all probably familiar with that name. You can see that the deductible and the out-of-pocket maximum match up. The office visit co-pays pretty well match up, maybe a little less, like on your primary care office visits, about $5 less than current. You know, a specialist visit is about $5 more than current. And if you go to an urgent care facility versus going to the ER, it's about $10 less than current. And then you can see again the applicable co-pays there for like an emergency room visit. There's a $250 copay, and then your deductible and co-insurance would apply for any type of an emergency care visit. United Healthcare obviously has a very robust provider network throughout the United States, and very comprehensive in the state of Nebraska. And then you can see the applicable copays for your prescription benefits, almost a match to what the employees currently have. The non-preferred brand is about $5 more for a 30-day supply, and a specialty medication's a couple $100, about $100 less than current. Those particular rates for that carrier comes in at about 2.6 below your current rates before you consider the renewal. Medica is the next column, and is another carrier that we do a lot of business with. In fact, a lot of the folks that I work with at Blue Cross now work for Medica. So very familiar with those folks. We, again, do a fair amount of business with them. And that particular plan, again, matches your deductible and co-insurance. The out-of-pocket maximum for the year is about $500 more than current. But the office visit co-pays, a little bit less on the primary care, about $5 more on the specialist, and significantly less if you go to the urgent care facility. I have highlighted there where it says preventative drug coverage at 100%. That's a real key element to doing business with Medica. They have about 200 medications on a 2-page list that and they come from all categories. It could be diabetic medications, it could be heart-related medications, they could be cholesterol medications. I have a complete list that I've shared with Chris and Dane. There's, again, about 200 medications on there. If any employees or family members are using a medication on that list, those are absolutely free. No deductible, no co-insurance. If I'm using a drug, let's say that it's a insulin, and the particular insulin that I'm using isn't on that list, but there could be 6 others listed there. About 90% of the time, the members of our groups will go to their doctor or the pharmacist and say, is there any reason I couldn't use one of these that's on this list? And again, the majority of the time, the answer is no. If you would rather use one of the other medications to treat your diabetes in this particular case, you're free to do that. So an employee will switch and use one of the medications that's absolutely no cost to them. So it doesn't cost them anything, doesn't cost the city anything. It's a tremendous benefit. I was explaining to Chris and Dane that a group your size, maybe not the first year, but certainly by the second year, you can expect to see somewhere between $30,000 and $50,000 in free drugs used by members of your plan. And then you can see that those particular premiums, these are all underwritten. This is a fully insured plan, no added risk to the city. They're about 10.6% below your current rates for the copay plan. The next 3 columns, the next 2 columns, where it says GMIC, these are self-insured plans. And the reason we wanted to have that on the option list for your administration to look at was because the city had been self-insured at one time. Self-insuring is a great tool. It does allow any employer to have more flexibility. You can kind of design the plan how you want. When your claim experience is running decent or well, any of the underwriting gain that would normally go to the insurance carrier, a self-insured employer keeps that in their own reserves. So when we had these quoted, under a worst case scenario. I mean, these are the maximum rates that the city could be faced with if all claims went south on us and everybody had a terrible year. So this is worst case scenario. So you can see that first plan is about 16% over current, but almost identically, well, it does identically match your current plan. And that next column with GMIC is about 4.9% over current. So somebody might say, well, why would we consider a plan that's 16% over our current rates? Well, it's about 1% more than what you're faced with on the renewal. But again, the reason that you might consider that is because it's self-insured, and if our claim experience is running decent, the underwriting gain, again, you keep that. That does not go to the insurance company. So that's one of the reasons it's probably the reason that the city looked at it used it years ago, and we just wanted to make sure that it was an option as a consideration for you again this year. Aetna, they declined to quote on it. They didn't like the way things looked, and so they declined to quote. So before I move on to the next page, can I answer any questions? And please throw all questions at me that you might have.
Is what we've seen before, and maybe not at the city, but I know when I was still working, is that we would get a really good rate to start. And as time went on, with really not much change in usage, the rates would go up. In other words, this is the hook to get us.
Yeah.
And then as time goes on, they get creeped and we're right back where we're at right now.
Right. Well, that's kind of what's happened to you currently.
Right.
You know, the association plan came in, looked, and tracked it. If it was a new startup, But after double-digit rate increases, it's kind of out of control. But Mayor, that's an excellent question, and I can tell you after 33 years of being in the business, there's no carrier that's buying the business because it's too volatile. And the cost of care continues to go like this, and for them to come in and try to buy business for 1 year, it doesn't pay them a dividend, and it doesn't pay you a dividend, and you don't keep business by doing that. So I'm not saying that didn't happen decades ago, but it's no longer applicable. Any other?
Is this a term, like a 1 year term, or a 3 year term, or 5 year term?
No, these rates are guaranteed for 1 year. You're not obligated.
So next year we might be doing the same thing again?
Well, what I do is we make sure that every year as we're approaching the renewal, that we go out and do the same research that we've done this year to present to you tonight. And if there's better options or other choices, we're certainly going to put those on a comparison and bring that to your administrative staff for review.
Shane, we usually try to bid it every 3 years to look at it as a city.
So what's the difference between the two GMICs? Is that just how they're broken down, employee only, employee spouse? You
No,
don't
that's-
just look at those percentages.
That's an excellent question. Thank you for asking that. So if you kind of look at the, right underneath where it says GMIC, that first column says 1215 on a spec and 1215 on an ag. And then the next column over says 1215 spec and 1212 on the ag. Okay. What that means is that you have like on a 1215, so the claims that are incurred in 12 months from July to July have to be in and filed and paid within 15, with a run-out period of 3 months. So you got the full calendar, the full 12 month of the plan year, and then you got a 3-month run-out period. I really don't like selling self-insured plans on the specific that's anything less than a 1215, because if things ran really poorly, or you just didn't want to self-insure the plan anymore and you wanted to go to a fully insured plan, I like to make sure that there's a run-out protection for you on those claims that were incurred. So that first column is with a run-out agreement. The second column is a 1215 on the specific, so that any of those high claimants, anybody that would have a claim that went over $60,000, the reinsurer has to pay those claims. So again, if we terminated with them at the end of the first year, we have up to 3 months after that for claims to come trickling in and still be applied to the stop loss contract. On the aggregate claims, all the claims that are under $60,000 for the entire population, all those claims that pool together, that second column is proposed at a 12-12 contract, which means we have to have all those claims accounted for and paid for within the 12 months. That is really, really rare that would happen, but it could happen, and that's why I showed it to you both ways. You can see there's a difference there, but 11 points, 12 points. So it depends on how much run-out protection you want to have. And I've fully explained that to Chris and Dane, and they understand it. They understand how those contracts work. So whichever way, if you wanted to go a self-insured route, and this is when I say self-insured, it's basically partially self-insured because, as I mentioned, any claim that would go over $60,000, you're off the hook. You're only funding it up to $60,000. When Dane and I talked about it before, previously when the city was self-insured, you had a specific stop loss level at $70,000. So this is well below that. Am I answering your question?
Yeah.
Okay, thank you. Sure.
Real quick.
Sure.
Another question is, what is I'm not sure how to put this, to the employees, how is the transition? I mean, ultimately the employees, the insurance is only as good as it is accessible.
Right.
And so you have to transition from one to the next, and sometimes that can be problematic, if I will. Are you there to help?
Oh, absolutely.
Right.
And again, very valid question, Mayor. We make sure that we do employee meetings, face-to-face meetings. We explain the plan. We are there to help handle the service issues, whether it's a claim issue or just somebody doesn't understand something. But we, as an agency, really prefer to do a face-to-face meeting with the employees and explain things. And if you've got, 30 days, 40 days on your side to transition from your current plan to the new plan, we can get that done without a problem. The other question that comes up a lot of times is an employee might say, well, I've already incurred part of my deductible for the calendar year, or part of my out-of-pocket. Do I have to start over? And the answer to that is no. We collect what we call a deductible report from Blue Cross in this case, and then we wait about 30 days to make sure any claims that were incurred have been in and processed and paid. And then we request that deductible and co-insurance report. We give that to the new carrier. They load that to their system, giving the employee credit for what's already been met for the year. Does that make sense to everybody? I think Aaron has a question.
Nope.
No? Okay.
Can I follow up on the mayor's question real quick, Bill?
Sure.
The providers, are they honoring all these insurances, especially the self-insured program? I mean, are they?
Yeah,
Are there issues with providers not providing coverage for somebody that's self-insured?
So thank you for that question. The network, the provider network, obviously the United Healthcare network is very well known. Medica is also very well known. The GMIC, we use Midland's Choice PPO network, which has been established in Nebraska for about 30 years and very well known. I'm not sure if there's any providers who don't contract with them.
Okay.
Yes.
The Jones's Group, your guys' fee, is that included in these numbers, or where is that?
Yeah.
It's already.
Yeah. So like United Healthcare or Medica, or whether it was even Blue Cross, they just have a standard rate that they pay us. It's not a percentage of the premium. It used to be a percentage of the premium, and that's no longer the case. I think with Medica and Blue Cross, it's around $35 or $38 per employee per month is how we're paid. And that's all built into these rates.
Good.
Okay, the second page on there is highlighted in orange, and that's your HSA plan, or Health Savings Account plan. And so a health savings account plan is typically a little higher deductible. And the reason for that is the federal government established these plans years ago, giving employees an opportunity to take a little more risk, a little higher deductible, a little higher out of pocket. And for agreeing to do that, they allow you to set money aside in a tax-free savings account. And I'd like to stress the fact that it's not a tax-deferred account. Those are tax-free accounts. So as long as you use the money that's in there appropriately, you never pay tax on that money. So we find it as a great tool. I'm glad to see that the city is offering it. It's not for everybody, and that's probably why you chose to offer two plans, because as you can see, you've got about 39 people enrolled in that plan. So to kind of walk through the plan designs quickly, the current plan from Blue Cross Blue Shield is a $3,000 deductible, 2 per family, and then it pays 100% co-insurance. So your out-of-pocket maximum is the same as what your deductible is, $3,000 out-of-pocket maximum, or $6,000 as a family. Now you'll see right underneath that deductible, that $3,000, we have it labeled as it's an aggregate deductible. So that means your current plan, if you're enrolled in this plan, you have to meet the family deductible. Even if I'm the only person in the family that got sick or needed health care, I have to meet the family deductible before the plan starts to pay. The proposals that we have here from United Healthcare and Medica, those are a embedded plan. And that's why the deductible is slightly higher. It's a $3,400 deductible with a 0 co-insurance. So your out-of-pocket maximum, however, is capped at the $3,400. So it is a slight more, $400 a year more in potential out-of-pocket if I maxed out my claims. But again, if I'm enrolled as a family and I only have one member of the family who gets ill or needs to use the healthcare system, as soon as that person has hit the $3,400, the plan pays 100% for that person. I don't have to meet the family deductible like you do under your current plan. Your current plan is an aggregate plan, so you have to meet the $6,000 deductible as a family before the plan starts to pay. Does that make sense to everybody? So we like to quote embedded plans when we know they're going to be competitive for you. So that's the difference between those two. Otherwise, the plan designs are matched up very, very as close as possible to your current plan. Under that Medica column, even though this is an HSA qualified plan, and part of the federal government says if you're going to have a high deductible plan, you can't, and you're going to put tax-free money aside in an account, you can't have any first dollar coverage. You can't have an office visit or a prescription that's paid before you meet your deductible. That's part of the IRS rules. But Medica found a way around that by offering that drug list that I referred to earlier as preventative care drugs. So those employees, if you're enrolled in the HSA plan, you do get those drugs free without having to meet your deductible. So again, it's a big plus for those people that are enrolled in that plan. So when you get to where it says change from current in the United Healthcare column, that's about 0.5% below your current rates for the HSA plan. The Medica plan, right next to it, is about 1.2% over current. So again, well below the renewal. And then the two plans from GMIC, one of them is about 34% over current, and the other one's about 21% over current. But what we have to do is we have to stack these plans. We have to have the copay plan and the HSA plan because you've got employees enrolled in both. So let's just pick on the United Healthcare plan again. If you follow that down to the bottom on that second page, I think it's highlighted in yellow. It says this is the total for both plans. So the total for both plans, as the current enrollment stands, would be about 1.43% below current, which saves about $20,000 under the current rates. The Medica plans combined is 4% below current, which is about a $56,000 savings. And then the self-insured plans are an increase when you combine the two plans. They are an increase over current. But again, I wanted to be sure and have those on there because there is some advantage to self-insuring if you choose to go that route. And if you chose not to go that route, if you were to consider making a change from the light or association program, each year we can reevaluate the self-insured plan and see if it's opportunistic for you to consider going back to a self-insured plan at some point in time. I mean, that's the work that we'll automatically do every year. You don't even have to ask us to do it. So that's kind of a quick summary of the two plans. And again, if you have some questions, obviously there's, I think, some attractive choices there for you, but again, please ask any questions that anybody might have.
Curious about what's the point C COBRA underneath all of this?
Oh, okay. Yeah, thank you for asking that. None of the fully insured carriers, Blue Cross, United Healthcare, Medica, none of them will offer COBRA administration. So if an employee, you're a large enough group that if an employee leaves the plan for whatever reason, you have to offer them COBRA rights under federal rule. So Dane says, well, we certainly don't want to administer that, which I wouldn't either. So point C will offer just COBRA administration, which for both plans, they would charge about $945 a year there's a $250 setup, but it's about $945 a year to have them take the full responsibility for administering the COBRA rights for the city.
Isn't there a deadline on that though? They can only draw it for so long afterwards?
If you go out on COBRA, if I just like left employment, or I was fired for, say it wasn't gross misconduct, I get up to 18 months COBRA. If I leave because of a divorce, I lose the plan because of a divorce, you get 29 or 30 months worth of COBRA. Yeah. A lot of people, it's nice to have the COBRA option there just in case I don't have any other choice. But most people don't take COBRA because they have to pay the full premium. And right now, like you guys are subsidizing the premium very heavily. And so when they find out what the real price is to buy the plan, they just typically say no. But you have to offer it, and some people do need it.
So the numbers reflected over here on the composite rates for the employees and whoever has these programs for this particular COBRA, are those the rates that we are paying for the employees or for the employees?
Which column are you?
Composite rates underneath the HSA plan, employee only 21, and then there's the rate, current rate.
Yes, yeah, those are the total unit rates.
Okay.
So as an example, using your current option, current plan, under that HSA plan, the employee only is $1,005 a month.
Right.
And with UHC, United Healthcare, it's $999.
But that's what the city is paying for that employee.
No, that's the total rate. So then the city, let's see, refresh my memory. The city,
Employees cover 100%.
okay, so the city pays 100% for the employee, and then you pay a pretty high percentage for the.
85%.
Pardon me?
85.
85%. So they pay 85% of the dependent cost.
So that's why I'm asking clarification. So employee only. So the first one in our current plan is $1,005 a month.
Yes.
The city pays for that employee. If they leave and wants to do the COBRA, then that's the rate that they pay.
Right. They pay $1,005 plus 2%.
Plus 2%.
Yeah, because COBRA administration adds on 2% for administrative.
Okay. Very good. Thank you.
Thank you.
So what's your recommendation out of these options? I mean, what are your thoughts?
Well, it'd be pretty hard to not look at Medica, quite frankly. I truly am a strong believer in the self-insuring, but this one doesn't make as much sense right now because the way, maybe a year from now it would, 2 years from now it would. I was renewing a county yesterday, and I had them under a self-insured plan for many years, and they were building a really nice reserve. And it's a little smaller group. There's only about 45 people enrolled in it total. And we were self-insuring that plan for years. And we were building a nice reserve, and then the illness burden set in. And I said, okay, you're gonna be faced with too much liability. So we're gonna, if the board agreed, we're going to move that plan back to a fully insured plan. You're gonna keep your $800,000 in reserve. We're gonna move the risk back to a fully insured plan. And when the time's right, and the illness burden has improved, we can move you back to a self-insured plan. Well, that's been 9 years ago, and it never improved. It never improved enough to where we could take them back to us. So the board went over with me yesterday from A to Z. Look, because they liked the idea of building a reserve, they really did. But the illness burden is just not completely cleaned up. So it's just not the right time to recommend that.
So if I'm seeing this right, for page one, for the copay plan, it looks to be for the employees about $120 savings per month. And then on your HSA plan, for employee only, you're looking at about a $12 a month increase.
That's over current, yes.
Current,
Yeah. That's why we like to compare it to the current, but the reality is the current's about ready to leave, and we're going to be faced with the renewal.
Right. Well, that's why I'm saying we should be comparing it actually to the renewal cost because
Yeah.
the current's out the window. So the new cost with the Medica is gonna be $130 less than.
Right. And the reason that I like to put them both on there, because I don't want to just try to paint some rosy picture that we're making a big improvement over the renewal. I like to compare it to what you're currently paying. Is it more or less than current? And then, to your point as well, now we got to look at the renewal, and that's a significant difference.
Appreciate that, thank you.
Yeah. Any other questions? Okay. If not, I'd like to have you take a look at, let's see, I think this is, let me do this.
Chris, does this, on the HSA currently, does the city contribute to that?
Yes,
How much is
2,000 and 1,000.
2,000, 4,000.
Oh, 4,000, that's right, sorry. 2,000 for the individual, 4,000 for the family.
And we prorate it, so if somebody starts in the middle of the year, then they get 1,000.
So based on how long they start. Thank you.
And whatever you would decide here doesn't change anything on that side if you choose to continue to contribute. Oh, you need one more? Sorry. Yeah, thank you. So what I just handed out is the, what I call the ancillary products that you're currently offering the employees also, which is the dental, vision, and life insurance. Yeah, thank you. So on the dental plan, we're looking at, again, the left-hand column is the current Blue Cross option. And then we went to 1, 2, 3, 4 other carriers. And these plans, as you can see, pretty much match up almost identical to the current plan. And then on the lower left-hand shows how many people are enrolled in the dental plan. 33 singles and 4 employee spouses, 7 employee children, 19 families. So if you just kind of go to the change from current, the bottom line, since the plan designs are almost identical, well, they are identical to your current plan, you can see the principal financial group is the one who is most aggressive, 36% below your current rate.
And these are something, sorry to interrupt you, these are something that the employee pays 100% of themselves.
Okay.
And also, if they choose one, they can't just take dental and work, or they can do one.
Yeah, they could do one or both or all three or whatever they want. But they don't have to take any if they don't choose, they choose not to, so.
Again, thank you for asking that. I mean, dental benefits are extremely important. I can't stress it enough, and you got a lot of people enrolled in it, so we want to make sure that if we can find a way to improve their costs, since they're paying for it, and specifically, that they have a good option.
That's a 1-year rate versus the 2-year rate then, right, on the Beam?
Yeah, Beam offered a 2-year rate guarantee. Principal and MetLife and Kansas City Life are all a 1 year. Yeah. But I can tell you that dental rates, they are trending up. I talked to my own dentist about it last week when I was in for my annual exam, and he said, our costs are increasing about 3% a year, and they always kind of complained that the insurance carriers don't reimburse them enough. Well, every time the insurance carriers increases that reimbursement, it's going to flow downhill to us as a consumer, and we're going to pay more in premium. But I understand their cost of doing business goes up. The next page is the vision plan, and that's with Guardian, and we again compared it to 4 other carriers, and matched up the benefits. If you look at the principal column again, and the reason I'm kind of focusing on them is because they came in here most aggressive over everybody else. But that very first line right underneath the title of principal, it says 12, 12, 12. That means that under that plan, you can get an exam every 12 months, you can get new lenses every 12 months, and you can get new frames every 12 months. Your current plan is a 12-12-24, so they're only allowed to get frames every 2 years. Okay? Your current plan has a $130 allowance towards those frames. Principal gives a $150 allowance towards those frames. So it is a richer plan, without a doubt, and they are 4.8, almost 4.9% below current.
See that it says $150 allowance plus a 20% discount.
Yes,
In
so,
our current plan, it just says plus discount, whatever that is.
yeah, we weren't sure if Guardian even offered a discount. So the example there is if I go in to get a new set of frames, and if I want a $400 frame, well, the first 150 is covered, and the balance I'll get a 20% discount on.
Very good.
On the dental and vision, a lot of times not every practice is going to accept.
Right.
Usually you have a list of who is and who isn't a part. Principal looks like a really good deal, and I don't know. I'm going to assume most people. I know what happens when you assume something, but the providers here in Holdrege, will they be able to use providers in Holdrege with these insurances?
Yes, so if you, and again, thank you for that question. If you look, go back to the dental page, and if you look where it says, there's a line that says general dentist within 25 miles of your zip code. And then if you go from left to right, you'll see how many providers are contracted within 25 miles. So in principal's case, there's 45 dentists.
There's more than that.
A little bit more than the current. And where it says 95 underneath that, that means that principal is reimbursing those dentists at the 95th percentile. And what that means is if I had 3 dentists and one of them charged $110, one of them charges $100, one charges $90, they average those together, they pay 95%. That's how they reimburse the provider. So could a provider come back and say, well, we're usually used to getting $5 more than what we were reimbursed? I've been seeing you for 10 years and you're going to charge me $5. I mean, typically my dentist would just say, I get it, and write it off.
Yep.
But that's what the 95th percentile means. And so Mayor, with that same question on the vision plan, if you see where it says network providers within 25 miles, your current provider network is VSP. That's about the second largest provider network in the country, and there's 7 providers. So every one of those who quoted on it is using the VSP network. So there'd be no change. And then the last page is your group life insurance. And currently, the employee is getting $20,000 of death benefit with an accidental death and dismemberment. You can see that for the current volume, based on all employees that are covered under this plan, based on that volume, the annual total premium is about $5,140 a year. All other carriers quoted it at $25,000 because that's kind of where they feel the minimum should be. So once again, they're all pretty aggressive. MetLife was the most aggressive at a 58% reduction over current. Principal's at almost a 31% reduction. So as Chris and I and Dane were talking, if you were to make a move, it'd just be nice to keep them all with one carrier, not split them up. So the Principal Life is not, I mean, it's savings, a nice savings, it's just not the most aggressive on the page.
So that keeps it cleaner and easier. But does it do we have the option to to do that life with the other?
You could, yeah. I mean, I've had, specifically some city groups that might have one or two products with one carrier, the health with another, and then another product with. It just kind of, from a billing perspective, you know, you got 3 different billings coming in, and it just cleans it up a little bit.
Mary would appreciate it.
Some of our office might get very upset if they have multiple.
And actually,
Won't say who.
That's right. It's unique,
and in this particular example, if you look at the annual cost difference between MetLife and Principal, it's about $1,400.
Right.
So we're not talking about a lot of money. Percentage-wise, it looks big, but dollar-wise, it's not that much.
Wow.
So that's the market search that we've done. We were very pleased with the outcome for the city of Holdrege. And again, I'd like to entertain any other questions regarding myself, the agency, the proposals.
Pretty black and white.
Yeah.
It's like Principal and Medica, huh? That's kind of what you're.
Well done.
That's, yeah. I would say it would be a good choice for you, yes. Yeah.
Is that a motion?
Do you have personal experience with United Healthcare, like negative experiences with them?
They could.
Um,
I I know that because my wife works with them a lot.
okay.
And they are the hardest insurance company to work with out of everybody.
They can be. They're so large. But sometimes the left hand doesn't know what the right hand's doing.
And which one are you talking about, Shane? I'm sorry.
United Healthcare.
Yeah.
Oh, yes.
And, you know, they report to Wall Street. Medica is a not-for-profit organization. So United Healthcare reports to Wall Street, so there's some issues there. They gotta make money. They can really be good, but I couldn't look in the eye and say it's not sometimes problematic. But I can also say this, there's hardly a day I go through that there isn't one of them that's problematic. It's just getting, to manage this stuff is just getting more. I don't care whether it's Blue Cross or Aetna or whoever it is, there's just more issues than there once was. Which is why we like to be there to explain things to the employees and be available to them when they need us. So we have an office, two of our locations are really heavy into the benefits product. One is Hastings, one is Seward. We have an office in Mendon, we have an office in Grand Island, Kearney. But most of our benefit stuff is done out of the Hastings office. So we have a staff of 4 there that we can always back each other up and count on each other and help do employee meetings or whatever it is that needs to be done.
Close proximity is nice.
Right.
Chris, when was our renewal date?
July 1st.
Open enrollment in June, which is
Coming up.
not far away.
Yeah.
You need a motion?
You wanna?
We could entertain one if you want.
I'll make a motion that we accept the offer from the Jones Group, accepting the Medica for the healthcare and Principal for the dental, vision, and life.
I'll second.
Aaron?
There.
Ben Johnson.
Yes.
Smith.
Yes.
Weiss.
Yeah, yes.
Tiller.
Yes.
Hart.
Yes.
Ward.
Yes.
Aaron Johnson.
Yes.
And Euchre.
Yes.
Thank you very much.
Thank you. I truly appreciate your questions and the thoroughness, and we truly value your business.
Thank you very much.
And this was very well represented.
Yes.
Nice job.
Thank you.
Good job.
You're welcome.
All
All right. Agenda item 5, approve change order number 1 to OA project 022-00533 IES 34.5 kV sub-transmission line rebuilt project.
This is the price increase of.
Yeah, and that was one of the items that we knew was the commodity price that was probably gonna take an increase when they bid it.
That's right.
And so that was highlighted under the original contract, and this is what the cost ended up being, so there is a bump there.
So that was the difference between
When
what
they
they
bid,
bid and what it actually is when it came to, yeah.
And that's both of the main conductors we're using. The T2 conductors are 13.8 distribution, and the T2 266 is 34.5 sub-transmission.
Right.
That's all of our conductor.
Okay.
As large as the project, that's pretty small increase.
Yeah.
Yes.
I agree.
It was like 34,000?
Yep.
Yep.
Is that, I'll make that motion. Okay, good. Nick moves
I'll second.
and Shane seconds.
Weeks,
Yes.
Tiller,
Yes.
Hart,
Yes.
Warren,
Yes.
Aaron Johnson,
Yes.
Euchre,
Yes.
Ben Johnson,
Yes.
Smith.
Yes. Excellent. Item agenda 6, approve the mayor's reappointment of Sam Brown as a member of the Board of Adjustments.
Was he on there once before? Or
Yes.
Yes.
And he stepped down and now
And now he's retired and he needs something to do, so now.
Okay, so before we were on, years ago, at least 3. Okay.
well, yeah, and plus trying to get people to get on a board. If somebody's offering, I'll take it. Yeah.
I'll make the motion.
Okay. Corey moves. I'll second. And Nick seconds.
Tiller,
Yes.
Hart,
Yes.
Warren,
Yes.
Aaron Johnson,
Yes.
Euchre,
Yes.
Ben Johnson,
Yes.
Smith, Weeks.
Yes.
Excellent. Thank you. Item agenda 7, approve Ridge Roberts as a new member of Holdrege Volunteer Fire Department. We've, Greg had a letter, I believe, and we got it.
I'll make the motion.
Nick moves.
I'll second.
Aaron.
He really wants to be a firefighter. I'm not saying no to.
Weeks,
Yes.
Tiller,
Yes.
Hart,
Yes.
Warren,
Yes.
Aaron Johnson,
Yes.
Euchre,
Yes.
Ben Johnson,
Yes.
Smith.
Yes.
Thank you. Open discussion. Tonight we'll start with Dane.
I don't have anything.
Chris.
The swimming pool was supposed to open this Saturday. It will not open until Tuesday. We can't get it to fill because the valve that closes to drain the pool is broken and won't close. So the water just goes in and goes back out. So they're gonna tear into that tomorrow and see if they can get that fixed.
Excellent. Thank you. Sergeant?
I got nothing.
Corey?
It might actually happen tomorrow. We actually have our sheriff's sale for the 6th Street property, 9 a.m. Sheriff's Office. Bring your checkbook. That's all I had.
Take a check.
I thought you wanted money.
I got 50 cents. I don't know. I think I got cash for that. Shane? Stacy? Laura?
No, only that I took a tour for the water department, took me around, to see the wells, to see the meter reader, and to see the, what's it called? Wastewater plant. I really think we need to start some sort of, I don't know, plan to let the people know, do not flush wipes.
Yes.
They are not, they're flushable but not degradable.
We several of us folks that have rental properties in Holdrege, that's in our contract. Can't use them anymore. You can't even get them to the sewer system. And I've toured that place. It is loaded.
Yeah,
It is.
I just don't think that the community knows that.
They're
When he
not
says
aware.
flushable, it's just too easy.
Yeah.
But to really let them know, it's,
Well, we put it out on Facebook before, and it's, I mean, other agencies try to promote that, but it's not. I mean, every community
Yeah.
It's the same problem in every community.
Yes, I was just gonna say, we're not the only ones that have that issue.
And it is terrible.
Need a jingle for that too, I guess.
Yeah.
Yeah, there we go. But it was really nice, the guys were really nice, very good.
Good.
Nothing for me. The road out there by, without doing the 5K line everywhere, looks good. Thank
That
you
was
for-
shared cost mechanic as far as that's county.
It looks great.
Or
There's not
city.
as many bumps anymore, but it looks nice. The American Legion will be putting flags out at Prairie Home Cemetery at 7 a.m. Anybody wants to volunteer to come out and help out on Memorial Day. And then we'll take them down at 4 p.m. Volunteers welcome. And we'll also have a Memorial Day service at 10 a.m. out there at the cemetery, the main center flagpole. That's all I have.
Okay, thank you. Yeah.
Question, does anybody have any idea? I'm receiving a lot of questions about when the potential 18th Avenue redo is gonna happen. Potential start date?
Maybe this fall. We're still in the design phase. Had a meeting today to talk about it. Contractors are very hungry, so I think if we didn't do it, it'd be a good time. I need to talk to the finance people, and I haven't got an estimate on cost yet, so that's kind of what we're waiting at. So
Next question,
we will let everyone know when we decide if we're gonna do that or not.
line of attack, I'm sure is gonna be one lane at a time.
I think they'll tear out the whole thing and do it and pour it back in half, or half the street at one time or in the other half. I don't know that for sure. I have not seen the final design plan.
You're also gonna narrow that up, aren't you?
Yeah, because I don't know if you ever noticed that street is,
Hell yeah.
it's 6 foot wider as it comes down the hill, it gets wider. So we'd actually narrow it up so it's all the same width.
Oh, nice.
Also, it's gonna be widened up to, up
No, it'll be-
completely?
It'll be narrowed because like at Trent's house, it's I can't remember what the distance is, but then as it comes down past him, it gets about 3 foot wider as it goes down through there. I didn't notice that until I was standing in the middle of the street here a while back. But yeah, so I'm waiting for the price, cost, the estimates, and the final design to know what we'll do.
I'm sure these guys, when they do this stuff for a living, they can access it now.
Yes.
Thank you.
Aaron?
Nothing for me.
I have nothing for tonight, so we'll call it a meeting. Thank you, everybody. Appreciate it.
Sure. And Trent, just so you know, like, all the houses in your yard, well, everybody else,